Welcome to the deep dive. This is where we really get into a topic, pull out the key insights for you, kind of like a shortcut to understanding something complex.
Exactly. We do the digging so you get the good stuff.
So today, we're diving into a YouTube transcript. It's called For the Love of Medicine, Ayahuasca Healing of Western Healthcare Practitioners.
Interesting title. From the Temple of the Way of Light.
That's the one. And our mission here is to explore what happened when these Western doctors and specialists went looking for healing using ayahuasca.
Right, so we're talking about people deep inside the Western medical system trying out, well, a very different indigenous tradition.
Yeah, and seeing it through their eyes, you've got this built-in tension, haven't you? Western medicine versus these ancient healing ways.
And the insights they brought back are pretty surprising, actually. It really challenges some assumptions.
Okay, let's jump in. What were their main frustrations? What did they feel was, lacking in their own medical background?
Well, a big one that comes through is this feeling of frustration. A sense that they couldn't always get to the root cause of illness.
Ah, okay. Not just treating symptoms, but the actual underlying problem.
Exactly. Particularly, they mentioned feeling limited when dealing with really high levels of trauma in their patients.
That makes sense. Was there anything about the training itself?
Yeah, one person mentioned how medical school focuses so much on pathology, disease, and even the dying process.
Which is obviously important, but maybe it overshadows the healing side. Or a more holistic view.
That seemed to be the feeling, like the focus was maybe too much on what's going wrong, biologically speaking.
And that leads to managing symptoms, right? You mentioned that.
Yes. The transcript talks quite a bit about painkillers, sedatives, things to manage the immediate distress.
But not necessarily fixing the deeper issue driving it all.
Precisely. So these doctors felt they were often treating the effect, not the fundamental cause.
It sounds a bit like, constantly patching leaks instead of fixing the plumbing.
That's a good way to put it. And another thing, something quite personal for them as practitioners.
What was that?
A lack of training in self-care, like how to clear their own energy or how to handle the emotional or energetic stuff they absorb from patients day in, day out.
Wow. Yeah, that's huge. You don't often think about that side of being a doctor.
No. And they felt the Western model really zeroes in on the physical body, the biology.
And maybe neglects the emotional, the spiritual, the energetic dimensions.
That's the picture they painted. That focus on the purely physical, it left a gap.
Yeah.
And that gap seems to be a big reason they went searching elsewhere.
Which brings us neatly to why they turned to indigenous practices, specifically ayahuasca. It wasn't just curiosity, was it?
No, it sounds much deeper than that. A real desire to learn from other cultures, other ways of healing.
And specifically the Shapibo healers, the indigenous practitioners who work with ayahuasca.
Yes, they talked about wanting to access that specific wisdom, that knowledge system. There was a lot of respect mentioned for the energy work these healers do.
Right, they could see the depth there, the effectiveness of it.
Absolutely. And recognizing that this isn't something new. This knowledge system, this tradition, it's been developed over thousands of years.
That kind of history really suggests it works, doesn't it? It's pragmatic.
It has to be, to survive and be passed down for so long. And it wasn't just about drinking ayahuasca either.
What else?
It was the whole package. The teachings, the cultural context, the connection to the rainforest, using other plants as well. It's a completely holistic system.
Okay, so that's the background, why they went. But what actually happened? What surprised them when they were there?
Several things really stood out. One was just the sheer speed and depth of the healing they felt they experienced.
Faster than they expected.
Much faster. Someone mentioned getting more done in maybe 12 days than in years of, conventional therapy.
12 days versus years, that's remarkable.
It really is. And another surprise, maybe a bit uncomfortable for them,
Go on.
was the amount of personal trauma that surfaced within their own group of healthcare professionals.
Really? You'd think maybe they'd have things more sorted out.
Well, that's the assumption, isn't it? But it seems being a healer in one system doesn't automatically mean you've dealt with all your own stuff, your own energetic baggage.
That's a powerful realization. Did they compare their training to how the Shapibo healers learn?
Oh, yeah. Big contrast. Indigenous training involves this deep immersion in nature, learning about countless plants, developing these healing songs, the Icaros.
Icaros, right. Those specific songs used in ceremonies?
Exactly. Very different from, say, learning pharmacology or surgical techniques in the West.
It sounds much more experiential, embodied.
Totally. They stress that you can't just understand this intellectually. You have to feel it, experience it in your body and your mind.
And ayahuasca is the key to unlocking that experience.
It's definitely described as a powerful catalyst
Yeah.
for doing that deep inner work. But again, it's not just the drink,
Right, you said it's the whole tradition.
the whole context, the setting, the guidance from the healers, the rituals, and especially, they talked about the Icaros again.
What about them?
The idea that the vibration of the plant spirit, transmitted through these songs, actually helps release trauma and sort of rebuild or restore your inner psychic structure.
Wow. Psychic structure, that's intense.
It is. They used the term psychic surgery at one point.
Psychic surgery, like incredibly precise work.
Yes, but done with, and this was emphasized, incredible love and care. It wasn't just clinical, it was deeply compassionate.
And it sounds like the healers could really tune into each person individually.
That was another point. The healers seemed able to access different realms or levels within each person, tailoring the healing.
Did they mention anything about dealing with pain differently?
Yes, that was a key insight. The indigenous approach often involves going into the pain, really feeling it to heal it.
Whereas the Western reflex might be to numb it or push it away,
Yeah.
with medication, for instance.
Exactly. So facing it, working through it, that was central.
And they actually saw this happening, people processing deep stuff.
Oh, yes. They described witnessing very physical releases of trauma shaking, crying, intense emotional expression, but all within this really held supportive space.
It sounds incredibly powerful, transformative.
Definitely the sense you get from the transcript.
Okay, so let's try and pull this together. What are the big lessons here? What could Western medicine potentially learn from these experiences?
Well, a dominant feeling was that the Western system, for all its strength, could be supplemented, maybe even completed, by incorporating some of these indigenous perspectives.
Like acknowledging the other dimensions of being human.
Precisely. The emotional, the spiritual, the energetic, bringing those back into the picture alongside the physical.
That makes sense. What else?
Humility came up quite a bit.
Humility. In what way?
These were highly educated, successful Western professionals, acknowledging the profound wisdom in a system completely outside their training, being willing to learn, to be immersed.
I can see that. Recognizing that your own model doesn't have all the answers.
Exactly. And also the sheer importance of love and care.
In the healing relationship.
Yes. That sense of connection, of being truly in service to the person seeking healing, that seemed fundamental to the indigenous approach they witnessed.
That feels like something that can sometimes get lost in a busy, maybe more impersonal healthcare system.
Perhaps. And connected to that is the healer's own state.
Ah, back to the self-care point.
Yes, the absolute necessity for practitioners to do their own work, clear their own energy.
Why? What's the risk if they don't?
The idea was that you could inadvertently contaminate the shared space, the psychic space, with your own unresolved stuff.
Right.
Which would actually hinder the patient's healing.
That's a really challenging thought for practitioners.
It is. It suggests a much deeper level of responsibility for one's own inner state when trying to help others.
So overall, what's the big potential they saw?
Huge potential. One person literally said that if Western medicine could embrace the kind of love and care that just radiates from this indigenous system, well, extraordinary things could happen.
Extraordinary things. That's quite a statement.
It really is. It points towards a future where these approaches could perhaps work together more.
Okay, so let's try to wrap up this deep dive. We've heard about Western medical folks finding really profound healing with ayahuasca.
Yeah, and through that, seeing the limitations in their own system, especially around root causes, trauma, and the non-physical aspects of health.
They really highlighted the need for a more holistic view, didn't they? Processing emotions, dealing with energy, and just the fundamental role of, well, love and care.
Absolutely. It's a powerful set of reflections.
Which leaves us, and you listening, with something to think about. Reflecting on all this, how might our Western ideas about health, about healing, need to evolve?
What parts of this conversation really clicked with you? What resonates with your own sense of well-being?
It's definitely worth exploring these areas more, thinking about indigenous healing, its potential, and how ancient wisdom might just enrich our modern approaches.
There's clearly a lot more to understand at that intersection. A fascinating journey.